In today's in-depth segment, there is an innovative online speech therapy solution called Gr8, or when you want to spell it out, it's Gr8. It uses video conferencing technology to give speech therapy lessons to patients wherever they happen to be. We sat down with the founder and clinical director of Gr8 Speech Incorporated to learn more how it works. Joining me right now is Avivit Ben-Aharon. Did I say it right?
You did.
That's great. And you have a company called Gr8 Speech Incorporated.
So it's Gr8 Speech, yes.
Gr8 Speech.
Yes.
So this is online speech therapy. So first of all, what do you mean by online speech therapy?
So what we do is we deliver effective, highly effective speech therapy services, but we use online. We use a web conferencing technology that allows us to connect with our clients via web. It looks very much like a Skype, but we use a highly regulated, HIPAA-compliant web conferencing technology, and it allows us to connect with our clients one-on-one and provide the therapy that they need. This in very similar manner as we would if we were doing it in a traditional setting, but it does allow us to connect in a very effective way, efficient way, very consistent delivery service model.
So why did you develop this company? Because was this your idea? Did somebody come with it? How long has it been in existence?
So the idea came about in 2009, and it came because I was working in a traditional therapy clinic setting, and a mom was there, and she actually said to me that the idea of taking her kids on a regular basis to speech therapy was very, very stressful. And in the waiting room, she was trying to manage the other 3 kids while one child was getting therapy. Yeah. And she said to me, she's like, why can't we do it online? It would be so much easier for me. And I came home and I started to do some research, and I did realize that you can deliver therapy, quality therapy, online. And I launched the company in 2009.
So how many speech pathologists are you actually using?
Currently, we have 8 speech therapists working with us, and we are licensed and certified in 31 states in the United States, and we're able to see clients all around, really all around the globe. We're seeing clients as far away as Africa and as close as Florida, and it allows us to connect with clients and especially deliver therapy to places that are unserved or underserved.
Now, who really uses speech pathologists and speech therapists? I mean,
anybody that has any kind of a communication issue. So whether you're a child and you're having a hard time making some sounds, or you're having a hard time communicating, or you're having issues with academic success or acquiring language, or if you're older and you're just wanting to work on improving your accent, or preparing for a job interview, or being able to improve.
What about stroke patients and those kind of things?
Absolutely, stroke patients as well. We actually have a client right now overseas whose daughter reached out to us. Her father had a stroke. He was 72 years old, highly educated man, had no access to therapy where he was, and she reached out to us, and he's receiving right now therapy online.
What I'm thinking of is, do you have to have a doctor that has done the diagnosis first? Because it's one thing to say, oh, I'll just do some speech pathology classes, but it's another thing to say, okay, I have a diagnosed problem. I need a clinician who can help me.
Absolutely. So we do a lot of diagnostic information. We obtain it as well. We can do assessments and testing online as well.
Oh, you can do the assessment?
We can do the assessment online as well, but oftentimes we do get a diagnosis or referral from other physicians who allow us to then know what we're looking at in terms of treatment.
Now, one thing I ask this because I'm always interested in the numbers, because there are some people who say that online learning, period, is not as effective, and there are others that say it's even more effective. Right. So how do you know that what you're doing is really achieving the goals that you want?
So we set very specific goals at the beginning of our therapy plan, and we follow those goals, and we constantly check in to make sure that the goals are being met. Our platform is a critical thinking platform. It is not a gaming platform where a kid or a client just sits and play games. We're controlling the therapy very much in terms of what our goals are for the therapy, and it really does allow us to reach clients who would need a specialist somewhere and cannot access a specialist. So we have a therapist who specializes in stuttering, and she's able to help clients who ordinarily will not be able to have access to that kind of therapy.
Now comes the big I question: insurance. Does insurance cover these kind of things or not?
Not yet, but I'm hoping that in the next few years insurance companies will begin to cover these type of therapy.
We are seeing that there are actually doctors on call and those kind of things that are using the internet, the same kind of deal. So expense-wise, do you charge the same amount of money?
We charge the same amount of money as we would in a traditional setting, but again, here you have the convenience factor and the time-saving factor, which is tremendous for a lot of our families, especially today where everybody's so overscheduled and nobody has has the time between soccer practice and guitar lessons. It's very hard to fit in the speech therapy services as well.
Now, another question, because this has come up with doctors on call that are on the internet. Somebody say, hey, you know, you're robbing people of jobs. Are you going to reduce the number of speech pathologists and speech therapists? Or just the opposite?
I think it's on the contrary. We're actually offering opportunities for work for therapists who ordinarily would not have the opportunities because of where they live or their life situations, or if their spouses tend to travel a lot and they have to follow wherever their spouse is. The caseload continues to go wherever these therapists go. So on the contrary, I think we're actually offering a lot more opportunities for therapists.
Now, are you the only company that does this, or are there others that are doing it?
No, there are other companies. There are definitely other companies, but we are the primary one here in Florida.
Now, do you work with any other, what I would call private speech pathology groups, or is this all just a standalone?
Yes, this is a standalone program that we developed for our clients.
For people that are still skeptical of online, what do you tell them? How do you bring them to the table and say, this might be something that works for you?
I often bring it back to, if you recall, when online banking started, and people were very, very apprehensive about the idea of, well, how are you going to manage your money through using the online model? And today, most of us are taking take a picture of a check and we deposit it that way. So the world is changing, and our goal really is to just make it very, very convenient and effective for our families and our clients so that the therapy can maintain and continue on a regular basis.
Now, you mentioned that you're working in 31 states, is that right?
31 states. We're licensed in 31 states.
When you say you're licensed, what does that mean?
So in order to provide the therapy that we're doing, we have to be licensed in the state in which we are residing as well as in the state in which our clients reside. So most of our therapists have multiple licenses that allow us to then connect with clients in multiple states.
Are you still looking for therapists that might want to work with you?
Always, yes. Always. We're always looking for very specific therapists who have specific skill set, who really are innovative, creative, and are willing to try on something new.
And what is the most common client that you have, the most common problem that they have? And I use problem because, that's just a throw term.
Sure. So the most common disorders we're seeing is a lot of stuttering clients, clients who are having a difficult time communicating, a lot of kids with articulation issues, the L's, the R's, the S's, the lateral, lisps, kids who are just not sounding very, very clear, and we get a lot of calls about that. And actually at an older age, we're getting a lot of calls from teens and young adults who are going into the workforce and realize the communication issues that they had as children were never resolved, and now would be a good opportunity for them to take care of.
Do you know that in second grade I stuttered so bad I couldn't even read a book out loud?
You see? So
something happened.
Something happened. Something great happened. So.
Last question. If people want to get a hold of you, how do they get a hold of you?
They can visit our website, Gr8speech.com, and go ahead and...
Gr8, G-R-E-A-T, or Gr8?
Speech.com. Yes, Gr8speech.com.
Good luck to you. Sounds like a very interesting program.
Thank you so much for your time. Thank you.